Before doing that, however, I want to talk a little bit about tonight's ceremony. But before doing that, a parenthetical remark. Without reference to any classes that have come before this class, and certainly without reference to any ones that may follow, I think I need to tell the people in the bleachers that the general sentiment among the administration and teachers who've come in contact with this class so far is that they're really a lovely group of people, and we thank you for sharing them with us. Chuck, can I have the first slide, please? So this is a ceremony of passage of some sort, and eventually I think this kid was grouchy enough to win himself some long pants, but basically you will get short coats and short pants to start out with, and hopefully move on from there. But this, as you may or may not know, probably don't know, is only the second year of the 51 years that Albert Einstein College of Medicine has been in effect that we've had this ceremony. And I think it's fair to spend just a couple of minutes on some of the aspects of getting and wearing a white coat that actually were matters of philosophical discussions in the past, and were some of the reasons that perhaps this was not done before, although I think once it was done the first year, one thing was eminently clear, and that is the positive aspects of this ceremony far outweigh any negative ones. I guess I can do this, Chuck. Okay, so one of the negative aspects was seen as having the white coat actually separate physicians and student physicians from their patients. So building a wall between you and the patient was seen as perhaps a negative aspect of wearing a white coat. And certainly this armadillo is wearing a stethoscope in the way most of you will learn to wear it. Actually putting it in your ears is helpful in using it in the future. But coats and garments of all sorts have been used in the past to separate physicians from their patients. This is a picture of a Venetian physician in the 16th century, and his name is Doctor of the Plague. And you can see that he is totally suited up and masked up, and this was really to prevent him from catching the plague. And the beak of that mask was filled with kindly smelling spirits and things to keep away the foul smells there. And as the class knows now, my subspecialty is infectious disease, so I actually am prepared to combat the advent of H1N1 influenza. So here's an article that came out quite recently, Bacterial Flora on the White Coats of Medical Students. And if you read the blue, the white coats of medical students are more likely to be bacteriologically contaminated at points of frequent contact, such as the sleeve and pocket. Significant proportion of students only laundered their coats occasionally. And this was in England, where perhaps they might launder them more than occasionally. And finally, a student's white coat is a potential source of cross-infection on the ward. Now, the other day, in an effort to teach people how to dress appropriately for patient encounters, I came out, not in this white coat, because this is the previous year, and then disappeared and came back with this garb on. And the point of that was to demonstrate that you really do need to dress appropriately. But given the previous article, I may have it totally backwards. And in the future, this may in fact be the garb that you should wear taking care of patients. Short sleeves, no white coat, maybe leg covering, but we'll have to talk about that another time. So other aspects of white coats that have provided at least philosophical problems for people in the past is this concept. The white coat has frequently been used as an authority garb to sell things, and often not the most wonderful of things. So more doctors smoke Camels than any other cigarette. And he's wearing his white coat, and looks like a doctor. When I was walking in, somebody said, "Gee, you look like a real doctor." And I said, "I play one on TV." So here's somebody in a white coat selling camels. And just to show you I don't favor any brand, here's someone selling in a white tunic, sort of Dr. Kildare tunic, selling Lucky Strike. There actually were 20,680 physicians, but one of them died of lung cancer, I think. And of course, after the war, and Rosie Riveter showed everyone that there was women's equality, ads started appearing with women physicians wearing white doctor garb, and again, selling camels. So certainly a distortion of what we would think the white coat ought to be all about. More recently, Dr. Jarvik was selling Lipitor. And Dr. Jarvik, it turns out, is not even an MD. And this ad was pulled, and the drug company seriously criticized for the implication that because Dr. Jarvik was wearing a white coat, that he was a physician and therefore had something really good to say about their product. On a much more serious and less joking mode, we have the aspect of Nazi physicians. Certainly wearing white coats. Here's one measuring the eye color of a suspect individual, a suspect of not being Aryan and perfect. And more recently than that, we have Radovan Karadzic, a Serbian who was a physician, is a physician, former psychiatrist, who has been dubbed really one of the worst war criminals of our current time. Also, very recently, physicians, presumably wearing white coats, have been implicated in some of the less than wonderful things that our government did to internees and prisoners captured during the Gulf War. And many physicians have been criticized by many other physicians for assessing that an internee or prisoner was in fact physically in good enough shape to be waterboarded or something else. So definitely a distortion of the humanitarian interests that we all would like to represent by the white coat. And here's a cartoon for those of you who can't read it. The policeman is saying, just because you're a doctor doesn't mean you can use the carpool lane by yourself. And the doctor says, but officer, my ego is so large it counts as a second passenger. And I think finally, here's a white coat. It's a long white coat. I have to thank Dr. Cimino for getting his wife to hang her long white coat on a hanger for him to take a picture of. And what you can see about this white coat is that the pockets are fully loaded. Books to read, sorry. Chuck, can you get me back? Thank you. Books to read, a stethoscope in the pocket, lots of pens and throat swabs and other things in the other pocket. And last year at the conclusion of my little talk, and this is the conclusion of my little talk, I made an offhand remark that seemed to resonate more with the audience than possibly my scripted remarks did. And that is that the most important thing for you to consider is not how to fill these pockets, but in fact how to fill the space between these buttons with the kind of physician that you hope, your families hope, and we all hope you will become. So thank you very much.